Well, the Israeli army is also saying it's paired up with Jordan to airdrop vital medical supplies to a field hospital in Gaza. A Jordanian plane dropped urgent medical aid and food to the Jordanian hospital in the Gaza Strip overnight. This, of course, comes as the humanitarian situation in the Gaza Strip is getting worse by the day. And to talk more about that with me now, let's bring in Tamara Alrifai, who is the head of external relations and communications for the UN Palestinian Refugee Agency, UNRWA. She joins me now live from Amman in Jordan. Tamara, thank you so much for taking the time to speak to us.
Yes, of course. Thank you for hosting UNRWA.
So tomorrow will mark 1 month since the start of this war. Close to 1.5 million people, which is more than half the population of the Gaza Strip, have now fled their homes. What are you hearing from your teams on the ground about their situation at the moment?
My team is talking about a really catastrophic humanitarian situation 1 month on. The 1.5 million people who moved or were forcibly displaced, this is much more than half the population. The population of Gaza stands at 2.2 million. So we're talking about 70% of people who are displaced away from their homes, most of them in shelters that belong to UNRWA, the UN Agency for Palestine Refugees. These are schools. They usually host little children for learning, for playing, for giggling. But right now they turned into shelters with people living in appalling and unsanitary conditions because of the shortage of everything: food, medical supplies, clean drinking water, and mostly fuel, to the point where UNRWA, the largest UN agency in Gaza, is finding it extremely difficult to assist people to the level that they require, even though we have not stopped working since day one.
Now, indeed, that's just for getting the aid to these people, but we're talking about tens of thousands more who can't even get into these refugee camps. What's the situation like for them?
It is doubly difficult. Those who are still in the north of the Gaza Strip, despite having received evacuation orders, have stayed for a variety of reasons. One of them can be that they did not want to leave their homes. They did not want to be displaced. Another reason can be that this is a combination of pregnant women, people with disabilities, young children, or the elderly who are not in a physical condition that allows them to leave. So the ones who have effectively left in the last couple of days come in addition to the 1 million or 1.5 million people who are already overcrowding half the Strip. And we're talking about one of the most densely populated places on Earth, with now it's almost the entirety of its population squeezed into half of the original surface.
What's the situation like in northern Gaza? Are your teams able to give aid to displaced people there now that Gaza City has been surrounded by the IDF?
No, our teams have not been able to circulate in the north of Gaza. And that is something that I'm glad you're asking me about, because our position is that humanitarian assistance should reach people where they are. And UN and aid groups must be able to circulate on the entirety of the Gaza Strip and do so safely. UNRWA has already lost 88 staff members, so I lost 88 colleagues over the last month. That should not be allowed. It is not allowed under international humanitarian law. But now, with the restriction on our ability to move, the people who stay in the north have almost no access at all to food, medicine, and to clean drinking water, which remains key if we want to preserve some public health.
Israel, though, had been calling on civilians in the north to evacuate to the south for their own safety. But monitors do say that less than 2,000 people did so. Why did so many people refuse to leave the north?
For a variety of reasons. You know, some of them are descendants of Palestine refugees who were expelled in 1948. And for them, this is akin to a new displacement, a new forced displacement. And they might not want to leave because they think, if we leave, we do not even know whether we can come back to our homes. Others, the sick, the elderly, the pregnant women, cannot walk out of the north of Gaza to the south. And that is why it is extremely important for aid agencies to be able to still deliver humanitarian assistance, food and water to them.
What are you noticing about the psychological toll on so many of the civilians there in Gaza? We had a report earlier that talked about people making this trip from north to south, walking along the road, seeing dead bodies on the side of the road. Is that something that your teams are also able to help them with in some way?
Our teams are hearing and are hearing about the very, very high price psychologically that the civilians in Gaza are paying. As a reminder, the Gaza Strip has been under a blockade for the last 16 years. So an air, sea, and land blockade since 16 years, and it has already gone through 5 or 6 devastating conflicts. So if you're anyone who's 30 or below, all you've known is that blockade, the restrictions, and wars.
Israel often mentions the risk that the aid given by agencies like yours could fall into the hands of Hamas and not go to civilians. And some stocks managed by the UN have already been attacked. What are you doing to make sure that kind of thing doesn't happen and your aid gets where it needs to go?
We receive and distribute the aid ourselves. So our trucks go and receive the trucks that are coming in from Egypt. We do what we call back-to-back. We get the stuff from the trucks that come in from Egypt onto our trucks, onto our warehouses, and then from our warehouses to the shelters. What you're referring to, that one day of our warehouses being looted, this was on the weekend of the total blackout, which aggravated the anxiety of people in Gaza and have made us, UNRWA, unable to communicate with them and say that we are going to be delivering bread today. That high level of anxiety pushed people into going into the UNRWA warehouses and taking whatever they found, having been under complete no communication, radio silence for 2 days.
All right, Tamara, thank you so much for taking the time to speak to us. Tamara Alrifai from UNRWA. Thank you.
Thanks.